Hello everyone, my name is Carlos and I would like to show you how to work in a new electronic health record targeting obstetricians called Nialls systems. So the first thing that we need to do is to go to Nialls.com. Nialls.com has a set of tools which will allow the user to have a pregnancy calculator including fetal biometry parameters and finding out how is the baby doing. Also for a pregnant woman or a doctor, finding out their ultrasound dates based on different parameters as well. And also computes some of the trisomies that are necessary to find out if a baby comes with some of the trisomy defects. It also contains a way of getting into an electronic health record and following up a patient. In other words, a doctor or a patient can include his information and finding out how a patient is doing. So for instance, I have a patient that I have started right here, Maria Lopez, and I can go into her record and try to continue on. So this electronic health record follows the American Congress for Obstetricians and Gynecologists and also contains some important VBAC calculations to forecast if a previous pregnancy that had a cesarean section can be normal. It also contains some of the fetal biometry parameters, things that are not included in normal electronic health records, with charts. And I'll look at this. So this is the history that it has past pregnancies, and it also contains all the visits and the initial physical examination. And all these charts will be with the patient and the doctor throughout the history of the pregnancy, so up to the delivery, and with no recommendations for the pediatrician that will take care of the baby after the baby is born. You see here, the VBAC is calculated based on, on the nomogram that is used as a standard calculation. So if we can go back to the original screen, we can also search for a patient inside. And let's say that we want to, right now we have just one patient, so if we search, for instance, for Lopez, obviously we should have retrievals by the patient last name. So she's expecting, and then we can retrieve, all her stuff again. This electronic health record computes automatically the birthday, the age of the patient based on the birthday and many other things that are necessary to save time for the user. If we want, we can log out of the system, and then we will go back to the login page. If you need information about this, you can go into the product section, and there are some screenshots with more patients that will give you a little bit more information of what the system can do for you. So for instance, in this page, we have here 4 patients with different trimesters, and they are signaled by the different color codes. We also have patients that have delivered and their sex and basically basic information about that patient. We also have things like an example of the chart that is contained to have fetal biometry, and seeing if the baby is growing normally using the Hadlock calculations. This is a chart that is not included in standard EHR. And I can also show a potential VBAC calculation, that is a calculator that forecasts if a patient can have a normal baby delivery after having a cesarean previously. So this is basically what the product does right now. It is in the prototype stage, and I hope that you have enjoyed my presentation. Thank you so much.